Clear Voices of Hope is a powerful collection of voices from For the Love of Cups, Clear Pathways program, dedicated to raising awareness about the realities of dense breast tissue and breast cancer. Through honest conversations and personal stories, we amplify the voices of women who have faced these challenges firsthand, sharing their journeys, fears, triumphs, and lessons learned along the way. Each episode brings you closer to the lived experiences of survivors, advocates, and caregivers, while also featuring leading experts in breast health and women's health. Together, we break down the barriers, provide vital education, and empower listeners to make informed decisions about their own breast health. Whether you're navigating your own diagnosis, supporting a loved one, or passionate about women's health equity, Clear Voices of Hope is your source for real stories, reliable information, and a supportive community. Join us as we shine a light on the path to early detection, better care, and hope for every woman. Welcome back to Clear Voices of Hope. I've got Kristin Derus Dore with me here today to share her story. I'm really happy and honored to have her here with us. I think you're going to really enjoy getting to know her. She's a delightful woman. She's got a wealth of knowledge and experience with cancer patients and in supporting the stress factor that can affect cancer patients, but also an experience with dense breast tissues. And I feel really lucky to have her here today. Kristin, thank you so much for joining us. Do you want to just take a minute and introduce yourself and let us know what brought you here today?
Absolutely, and thank you, Lisa. I really am honored to be here, and I feel really grateful to be a part of the powerful work that you're doing. But yeah, I'm Kristin, and I'm a wife of 2 years, newly remarried, and I'm a mother of 3 dogs and 2 fantastic grown children who are 28 and 26. And 4 years ago or so, I started my own business, and I've been really feeling very successful with that. And, you know, I guess I always, in the back of my mind, I knew dense breast tissue ran in the family. My mom and her sisters always talked about it. I never really understood what that meant. And once I did, it was a little bit too late. I was already, somewhat down that journey of testing and stuff. But I guess I was just really disappointed and frustrated that I hadn't known more sooner. And I love your mission of trying to educate people, and I just really want to do everything I can to share my story to see if it can be useful.
I relate to that so much. I think I had that awakening too when I was diagnosed with it, but more so, a little bit further down the road when I was looking back, and once I had learned more about it and how crucial it was to understand what it meant for me and how nobody had told me. Like, I just was really genuinely shocked that this was not information that I was aware of, knew, and nobody had even tried to fill me in on. It was a path much like yours, I imagine, that you had to go down on your own. Can you tell me a little bit what that was like?
Well, I almost want to begin a little bit further back, because in my work, I work with a lot of people who are cancer survivors or currently going through cancer. And so I visit with a lot of them. So I've heard a lot of stories. And, I turned 40, I turned 45, regular mammograms were recommended, and I had some. And I was talking with one of my clients, and she said, first of all, if you have a mammogram, make sure to ask for a thyroid shield. And I was like, what? What even is that? It's a little collar that goes here with a kind of a scoop here that would protect your thyroid from the radiation of mammograms. Because if you're getting one every year, that's not really healthy for you. Well, hot tip right there. I was talking about that with another client, and she said she actually recommends getting screening ultrasounds because mammograms didn't catch her breast cancer because of dense breasts. And she had found a company called HerScan where you can go and get a breast ultrasound at a reasonable price almost any time you want. They have availability all the time. And her name is Sherry, and she actually, after her breast cancer journey, started a company that makes a special brush. So when you're losing your hair, it's more gentle. And she actually gifted me a free HerScan ultrasound.
Wow.
So I wasn't screening with mammograms. I started screening through the ultrasound. It was more comfortable. I didn't have to worry about radiation. And I felt like it was more effective for my particular breasts. And it was just so easy. And, after your co-pays and stuff, the price was probably about the same. So that's kind of the beginning of my story, was I wasn't even doing screening mammograms. So then this year I was supposed to have my HER-scan ultrasound in January, and they bring in people from all over the country. I'm in Minnesota. There was weather. So they asked if I could do it later in the day instead of my appointment, like at 9 wasn't available because the technician had trouble flying in. Well, Lisa, they wanted me to come in at 7 o'clock at night. Nah, no thank you. I've never worried about breast cancer. It doesn't run in my family. I knew I didn't have it, so I was like, don't worry about it. I'll reschedule. Flash forward 6 months. I finally got around to rescheduling because I had no concern at all about breast cancer. And when I did the reschedule, it was a little strange because she was doing the ultrasound, and we were visiting with the technician, and she did the first breast, no problem. And on the second one, she was taking longer, and then she had me move a few times. But then she said that the picture had been a little blurry. Looking back on it, I can see she was probably observing something that shouldn't have been there or that was concerning. But at the time, I just kind of ignored it and forgot, tra-la-la. So a week or two later, I was, told I should go in to the doctor, that there was something concerning on my ultrasound. So I did what you'd probably do. I called the doctor's office. I told them I'd send the records over, and I asked to have an appointment. And they said I couldn't make one. Even though I was overdue for a screening mammogram, they said because I had concerning results from somewhere else, only a doctor could now order a mammogram or an ultrasound through this clinic. So I'm telling you I have a problem. I'm pretty concerned, and you're not helping. Fortunately, I was due for a physical, and my doctor had an opening that day. So I went into my regular doctor. I showed her the results. She said, you should go in right away for a mammogram. And I said, I need your help. I wanted to. So then she wrote down the number to call for the mammogram, and she gave it to me and said, you're going to want to call from the car. And you just don't want to hear that, because everything is telling me this is bad, right? Mm-hmm. And Lisa, we've all had ups and downs in our life. I've had times, not when I was suicidal, but when I thought, well, life is so hard. If I wasn't here, I guess that wouldn't be the worst, or my family would be fine. But you know how it is. When you look it in the face, you do not want to die. And so I called from the car, got the same receptionist. She's like, oh yeah, there's an order. We can get you in. So I went in for a screening mammogram and an ultrasound. And when I went in, first of all, they told me to be there 15 minutes early for my appointment at 8 a.m. So I got there at 7:45 with a number of other patients, and the receptionist was so rude. She said, we don't open till 8. Yeah, but we were all told to be here 15 minutes early, and now we're here. We all look kind of nervous. None of us is here really for fun. No one wants to. So that was just kind of a bad start to the day. And it sort of went worse from there. The mammographer, I asked for a thyroid shield, and she was rude about it. She said maybe there was one somewhere. She went away for a long time before bringing me one, and then insisting I didn't need it because there's not that much radiation and everyone does it. So I just didn't feel like my choices were honored. Yeah. And then she and the ultrasound technician and the doctor who redid the ultrasound were all really judgmental about why wasn't I getting mammograms? Why wasn't I coming in? Why was I getting these ultrasounds? They all asked, like, were you having a problem with your breasts? Why did you go in? And I shared my concerns about radiation and about the effectiveness of mammography. And the doctor was lecturing me, and finally I said, okay, so did whatever's in my breast that you're so concerned about, that I need to have a biopsy right away, did that show up on the mammogram? And she said no. So that means whatever I found through my screening process that you're very concerned about would still be incubating if I was doing it your way. So I was super frustrated. I didn't feel validated at all. I decided at that point I was on this track. I would have them diagnose whatever was going on, but there was no way I would have treatment here. I would have to find somewhere else. The U of M, the Mayo Clinic, these are all available to me in Minnesota. So even though I was going to a highly regarded breast center, I was just like, no, this will end as soon as you say yes or no. Just tell me something. And I went in for the ultrasound, or for the biopsy, and it was more of the same. Although there it was interesting because they said that whatever it was we were catching very early, and they'd have to put in some markers because they wouldn't be able to find it again. The biopsy would get so much of it. They said at its largest, the spot was about 4 millimeters. And it was toward the top of my breast versus inside, like near lymph system or anything like that. And so that did give me a lot of hope. Like worst case, it felt like something that could probably be surgically removed versus that would have spread. Because I had caught whatever it was really early. And they were kind about giving me the results right away. And they said it wasn't cancerous, although it could turn into cancer. So they suggested I screen more frequently. So I asked what that was then and when I should come back. And they said, well, in 3 to 9 months. And I didn't feel like that was that useful either, because 3 months to 9 months, those are just different amounts of time. Should I split the difference and do 6? Should I be going in 3? Like, help me out. And and they did say, because I have dense breasts, it was harder to do the mammograms. And they did, say I could look in the portal to learn more. And there's a whole bunch of information in there that doesn't make sense, that no one's really explained to me. Even like how likely this is to turn into cancer, what my real risk factors are. I'm still sort of unclear on that, but all of this happened about a month and a half ago. And so I'm kind of just settling into sort of what happened and then kind of figuring it out, like going forward next steps, and where I will go for treatment and screenings and who I do want to be on my care team, because I just felt, unsupported, and it made it all worse and harder to have to go through that. And I feel extremely blessed to not have cancer right now, but the specter of it exists in my life now.
Yeah, it reminds me of somebody like myself who has been diagnosed with breast cancer, but in many ways we're in the same position of just keeping an eye on things, right? So you're still in that breast cancer tracking community, right? Like we're doing the same things, you and I, similar in any case, right? Stories like yours, I think, are so important for that reason, because I think a lot of women, or maybe the conversations aren't as prevalent because they think, well, I wasn't diagnosed with breast cancer, so then it's not that bad, or it's not that big of a deal. But it really is. Like, that's the whole point of why we're doing the screening, why we're having these conversations, is so that we can offer support, catch it early if there is something that becomes cancerous. I'm just heartbroken for you, and I'm so sorry that this was your experience from the beginning, being dismissed in that way and just feeling so alone and, I don't want to use the word disempowered, but they were really turning you away and taking away your power in many ways. And even when you took like the steps to take care of yourself, seek out the screening that you knew was going to be beneficial to you, that was actually going to do what you needed it to, then on top of that, adding more shame to what you were doing. It's bizarre, but that's the system. That's the system. And I remember when I was told I had dense breast tissue, then they said, okay, well, you might want an ultrasound. They weren't going to pay for it, though. They said out of pocket $400 to $500. So it's exactly the same thing that you were doing. You were just going to go take care of it. I remember asking, when I came back for a follow-up, I said, I don't want to go through another mammogram. Can I just go straight to the ultrasound? No, you have to have the mammogram first. I was like, but why? Right? So it's all these extra steps that not always are necessary. And then, like you said, you kept getting sent away. And this is the piece that, a lot of women, you want to give up. You want to think, okay, well, I'm probably fine. So, what, I'm just going to do my best not to worry about it, because who has time for this? And, and who has energy for this? And it's causing you extra stress and worry. But at the end of the day, if we don't take the time to advocate and put the time and the energy in it, then we're really not getting that screening, that reassurance, that clarity, that knowledge, all the things that we want to actually benefit from in an early detection. I'm really sorry that was your experience. I can feel the heartbreak in it. It takes me right back to those moments for myself. And And I think a lot of women are going to be able to relate to that, and just your willingness to persevere in those moments and speak up, even if it wasn't received in those moments. I know, you're making it a little bit easier for the woman that comes behind you.
Well, and even on the subject of like on the cost of it, then this week I got a bill for $3,000. Well, over that for all this stuff through the doctor, and I'm like, all the stuff I had to fight to get, So then it's also, like you said, really expensive. And I think the ultrasound there, yeah, it was like $400 or $500 on the itemized bill, but they're less than 300 through her scan, and they're flying someone out and doing per diem and hotel rooms and all this stuff. And so I don't understand either some of those costs, but I'll definitely do the follow-up screenings. I'll get ultrasounds myself, and then I'll just see what comes, because I just was left feeling really judged, and like I can't trust the doctor because they didn't fully explain the dense breast tissue either, and they didn't fully explain a lot of that stuff. And most of the conversations we had, I'm like in this smock thing. Sometimes my breasts are out, like to your point, I'm vulnerable, I'm scared. Even if you bring someone with you, they're not allowed in any of the treatment rooms or anything. They're not allowed to hold your hand during the biopsy or anything. You have to do all that yourself. And there's 4 or 5 people in there, doing all this stuff, and you're just alone. It was really scary, and it was just really hard. And I thought about, I suppose my kids would be fine, but like, what about my little dogs? I just got married, I just like finally thought, here we go, your life is restarting, and now it's maybe over or very changed, And I think, my biggest point of being here is it's the community of women and survivors who I know, who set me up to advocate for myself and to know about this stuff and to be here now. Otherwise, I may have just gotten the regular old mammogram with no thyroid shield. It wouldn't have found anything, and it would be growing. And by the time they found it, who knows what my health would be or what my prognosis would be. So I just feel really grateful to have the community of people I've met and those survivors passing on their message. And I just want to do the same thing.
Ugh. Oh, I'm going to start crying. It's really, that is what it's about, though, honestly. If we didn't have each other, if we weren't willing to speak up like you are today, and like your friends did for you, like the woman did for me, like I know I wouldn't be here, not as healthy as I am today in any case, for that willingness, for that courage. And that really is our best resource and our best tool right now, is having people in our corner passing on that information, and even leaning on them in those moments where you do come up against some resistance, because you're going to need each other even more then to keep pushing through.
Well, and just hearing your story, a lot of that resonates with me, and it makes me just feel more seen and heard, to know that even though it's crap that I had to go through that, I'm not the only one. And it's it makes it worse in some ways that a lot of us are treated this way, but also it's just really validating to be like, I'm not crazy. I'm not imagining this. I'm not overreacting. My experience was real, and it's happening to other people who might be less able to advocate for themselves. They might have little kids at home. I have a flexible schedule because I have my own business. So I'm very blessed to be able to get in a car and drive to an appointment and drive back. If it was my old job 5 years ago, I would have been punching a clock, begging my boss for time away to go take care of my health. Sometimes it doesn't feel like you can prioritize yourself. And so I was fortunate not to have some of those additional barriers that women face. And what do you do?
That's exactly it. That's exactly why we're here, because there are so many women that are facing much bigger barriers than even we have faced. And I kept thinking that if it's this hard for me, what must it be like for women with bigger obstacles? Not a car, not a ride, a job that they can't step away from without a whole lot of scrutiny. Money to put more gas in the tank, the extra copay, paying out of pocket for the screening, like it just builds and builds and builds. And, women like that need their community even more. They need access to conversations like this, and to be empowered to have those conversations with information to back them up. And, even what you're doing now, building a new team for yourself, a team that you feel like sees you, that you trust them and they trust you. It's so important. I went through something similar with my journey. I ended up firing my whole team because they weren't seeing me. They weren't honoring what I was hoping for. And I just had a belief that there had to be a better doctor out there. There had to be a better team out there. And thank goodness there was. So I just want to encourage you to keep going. They are out there. They do exist. And I think you'll find your way to them. And I think it's really smart to start at the stage that you're at to do that and have those people that you trust. So I didn't realize that this had happened so recently for you. You're really fresh on the heels of all this, or still actually in it, right? Building a new team for yourself, people that can see you as a whole being, as a wise, informed woman that you are, and a patient that wants to work with her team. Do you want to tell us a little bit about where you're at?
Yeah, it is really fresh. I think because I don't have cancer right now, there's almost a lack of support for what I went through because I'm fine, right? And so you're fine, so just get over it. And I was pleased to learn about your podcast and the opportunity to participate because it doesn't feel like it's done to me. I know I'm well right now, but the specter of it is in the back of my mind all the time. And I'm trying to make changes too to support my health even more. I never worried about breast cancer because I've been a vegetarian for over 20 years. And so I think I have a really good diet, and I haven't drank alcohol since I adopted my children 18 years ago because they had alcoholic parents. So I wanted to demonstrate that you don't need alcohol to have fun, And so I make really good lifestyle choices, and I was pretty surprised that I could even have cancer. But now I've kind of doubled down on the lifestyle choices where I'm trying to research other things I can do to support my health. And I don't know if that's just because it's so fresh and I want to jump in and do everything I can, or if this stuff will stick forever. But I'm looking at sugar and dairy and processed grains. And is there anything else I could do? Because I guess when I thought I might have cancer, I was kind of blaming myself too. Well, did I do something to cause this? Okay, well, I have dense breasts. That's from my mom. Well, could anything else have done it? What else causes cancer? And I didn't want to get stuck in that trap, but I can still sort of feel that I am a bit, I'm not diagnosed with anything and I just have to do follow-ups on some vague timeline. But it still feels like I want to try to do more to protect my health, and maybe that is just because it's still so fresh and I'm not quite over it.
You bring up such a good point, though, because it's such an interesting dance to do, because, of course, you want to feel empowered in taking better care of yourself, right? You want to stand the best chance possible of remaining healthy, staying healthy, and being able to bounce back from anything that might come your way, whether it's cancer or the cold or the flu, right? You want to be able to have a body that's ready to heal. And yet there's that piece of, could I have done more? Did I do enough? Did I cause this? That I know this, right? That's such a tough burden to put on yourself and to anybody else, right? The belief that we could have caused this or deserved this in some way. I know these feelings are real. I know that they come up for a lot of people. It's a common theme that I hear often in these conversations and with my community. And even sometimes from outsiders that want to give you unsolicited advice. But to also just not buy into that, right? Because that's not actually a very constructive road to go down. It's not actually serving anything if we allow ourselves to go down to that belief that somehow we caused this. But flipping that script into empowering ourselves to have our body be in partnership with us, being as well as we can possibly help it to be, so that we can feel as good as we possibly can.
I think if you go too far into that, then you won't enjoy your life. So maybe you're prolonging it, but then if I'm prolonging it by never having a Snicker bar, if I really want one or whatever it is. So I think I'm just still trying to kind of find what that line is for myself.
Yes, because joy plays a factor, right? Doing things that feel joyful, that feel good, that you enjoy, that bring you life and happiness and community and all those things. Sometimes it is a birthday cake that brings people together and makes them happy, and there's a little sugar in there. But I think to your point, there's some balance to be had in there, right? There's a lot of balance to find and allowing yourself to enjoy life in those ways while taking really exquisite care of yourself. You do work with, I'm going to get it wrong, so I'm going to biofeedback, biomarkers, something with the way stress particularly can affect cancer. So I'm wondering if you want to share just a little bit about that, because we're kind of on that subject. I mean, we do know that stress does play a role in many diseases, but in particular cancer. And I'm just kind of wondering, like, does that knowledge help you and serve you, or does it just like, oh, now you know too much?
You know, Lisa, I think that's a great question, and I think it's both. So yes, my business is biofeedback. It's FDA approved for stress reduction and pain management. But research at a number of bodies of medicine, including the Mayo Clinic, has found up to 90% of disease is caused by stress. And if we think of disease, it's more like dis-ease or discomfort. So it's not like if you're stressed, you immediately get an illness, right? But when you're stressed, your body is just more run down, and your defenses and your self-healing are smothered. You know, one example I like to think of is cold sores. So like if you get cold sores, that virus is always in your body, right? Forever. But you don't have a cold sore every day of your life. So sometimes certain circumstances you encounter or stressors make your body more vulnerable to developing a cold sore, for example. So, I mean, it's somewhat the same way with cancer. The cancer cell is just kind of a cell growing out of its original design, the way it doesn't belong. And every day our body produces accidental messed up cells, and usually our immune system identifies and flushes them away. But when that doesn't happen, they can become a growth and a cancerous tumor. And so if your body's functioning optimally, it doesn't mean you can't get cancer, but if it's functioning optimally, it would just be better able to weed that stuff out. You know, and there's just a lot of research too on how if you're really stressed out or upset, whatever you're having at the doctor, you know, the treatments, the medicine, it's not as effective. Sometimes, you know, the more you stress out about something, the harder it is. And I almost think it can be the same thing about wellness. Like if you're really stressed out about getting cancer, you know, I don't think you can create it, but it definitely can feel that way. And if you're stressed out about healing, sometimes you almost get in your own way. So just trying to manage all that, I think is good. But because I do biofeedback, obviously I work on myself. That was another reason I was so surprised I could have cancer. I'm like, but I'm vegetarian and I don't drink and I don't have a family history and I do biofeedback. Like, this is impossible. But it isn't. No matter what you do, it could still happen, you know? And so I think, to your point, that's why it's so silly that now I'm trying to find ways to prevent it for myself, because eventually I know that, you know, anyone can get it and you can never get it. It just depends on a lot of things. Even on the family history piece, a few years ago, my cousins and I were all turning 40. And some of them were doing a genetic test instead of like getting breast cancer or colon cancer screenings, because they figured if they didn't have the gene for it, they'd skip it. So I talked to my doctor about it, and she said, I don't know this, I've never researched these facts, but she said only about 10% of cancer is hereditary.
That's
all
correct.
The rest of it is lifestyle and other stuff. And so she said, even if I don't have the gene, it would be unwise to just skip a colonoscopy and skip my breast cancer screenings. And so some of my cousins have had those screenings, or are not having screenings based on not having the genes. And I mean, I'm trying to educate them as well. The information we think we know versus what the facts are, you know, and I mean, I'm back to the subject of dense breasts. I've never been officially told by the doctor that I have them, but I read it somewhere in my chart, and my family has it, so that's kind of how I know I have them. And I've never been educated on it, on any of the additional risk factors or what it could mean for my breast health or anything else. And so that's something I'm just starting to research.
Yeah, it's pretty shocking. And it just varies wildly depending on your healthcare team. I mean, the national mandate only went into effect within the last year to just tell women via letter that they have dense breast tissue. But that's it. That's all that's required. So there's not a whole lot of education or follow-up. There's so many ways to fall through the cracks unless you've got a really, really great care team that wants to sit you down, talk to you, and let you know what it means and provide that follow-up care. But I think that is definitely not the norm. It's unusual to have that level of care. And we're hoping to change that. But in the meantime, what we have is each other. And this is really an important step forward in getting that information, and then also just dispersing it as quickly as we can so other women can have access to it. Before we wrap up today, I'm wondering if there's anything else you'd like to share about your journey, or if there's any sort of piece of advice or wisdom you want to leave with us.
I mean, I think it really is just that I've always kind of thought that, like, if someone's in the hospital or if someone's going through something, it's important to be your own advocate, because yes, the medical team can be really great and they can be on the top of their game. But in the end, you're a patient to them, so you're another number. And you are your only you, right? You're the only parent, you're the only mom your kids have, or, you know, the only person who's your daughter or cousin or spouse or whatever it is, right? You're the only one to so many people, and you have to take care of you first. And so if it's discouraging, I mean, find help, go somewhere else, you know, check out resources like this. But I guess if you know something's wrong, just keep looking for it, you know, or keep digging. And I'm doing a bad job of this, but don't let people judge your choices, or don't be bothered by it. Understand that they might be judgmental about the way you're screening or something else, but if it's right for you, that's the path you need to be on. Because at the end of the day, when you go to sleep, you need to feel good about your choices instead of laying there thinking, oh my gosh, I wonder if I have cancer and I didn't go in. You know, you need to be able to live with your choices.
I think what a beautiful note to wrap up with. I think that's the biggest thing, because either way, no matter what, there's no guarantees, right? Kind of like what you said. And I don't say that to make people feel hopeless, but to find peace with your choices, right? You at the end of the day need to be confident in your choices and take away as many what ifs as possible to do what you need to do to give yourself peace at the end of the day. And that only lies with you, that only rests with you. And hopefully that there's a lot of comfort in that. I know I take comfort in that, and I hope that others do too. Thank you, Kristin. I'm really grateful to have this time with you. It feels like a really special conversation to have been able to have with you, to be in this with you, and share your story and get it out to some more women and grow this community with your experience. I'm really, really grateful for you.
Just grateful for you and the work you're doing and how hard you're working for all of us to both build a community and then educate us individually, and even the work you're trying to do nationally. Like, you're just an inspiration, Lisa. So we're so blessed to have you here. I'm really grateful that you caught your cancer early and that you are a survivor, because we need you here. The world is a better place with you.
Same, right? I mean, there's a lot of, like, women are amazing and we need us all healthy. I love us. I love us. Thank you. Thank you, Kristin. I adore you. I'm so grateful to have you. Thank you for being here.